These are the 6 products I cannot live without in hygiene. The first product is the Parkell's Burnet Power Tip. I've been using this power tip for a couple of years now, and it's fantastic. It's kind of between a universal and a perio tip, you can say. It's longer and thinner than a typical universal tip, but not quite as thin as a very thin perio tip. So you get better access compared to a universal tip and much more power. I would say about 80% of my scaling is done with this tip, and the remaining 20% I supplement with a thin perio tip or hand scaling. I think they sell for about $140 something, and not cheap, but definitely worth the money. It's by far the best tip I've ever used, I would say. The second product is the Isolite mouthpiece. I've been using this for a couple of years, and I use it for 2 primary reasons in hygiene. I use it for air polishing and placing sealants. It really allows you to place quality sealants alone, and makes it a much quicker process. And with air polishing, it just makes it much more efficient with the evacuation, and also reduces the mess that air polishing creates. Each mouthpiece is about $250, and a lot of people hear that price and they go, "Oh, that's too much." But it's worth the money because the time it saves you during procedures. It's going to cut down on time, at least 20-30%. So it's well worth the $250 that you're going to invest in each, for each patient. There are 3 ways you can connect the Isolite mouthpiece to your HVE system. The first one is with a cone adapter, which is my product that I sell. So it's a disclaimer there. The second one is the Palmer Isolite adapter, which is also a very affordable option. And the third, of course, you can use a Isolite system, the Isolite Iso Dry or the IsoVac. The third product is suction mirrors. Suction mirrors have been around for a long time, but for some reason, most hygienists don't use them. I'm not sure why. I know when I was in hygiene school, they were never mentioned. I discovered them on my own. The one I use, you can autoclave. It's about $36, long lasting, very good quality. I use it mainly with ultrasonic scaling. It provides, retraction and suction at the same time, and it works super well for that. I used to use the Isolite mouthpiece for, when I use ultrasonic scaler, but I found out with Isolite mouthpiece, you lose a little bit of room, and I was finding myself supplementing with the suction mirror anyway, so now I just primarily use the suction mirror with power scaling. There's a new suction mirror that just came out on the market that was designed by a fellow hygienist. It's the Hammerhead. I've only watched videos of it in use and pictures and whatnot, and the design looks fantastic, and it just looks like it's going to perform really well. The price is a little high, it seems, but it might be worth the money, and we'll see. I'm gonna buy a couple soon here and test it out, and I'm sure the performance is gonna be pretty impressive. Let's see. The fourth product is an air polisher. I use air polisher with all my ortho patients and adults or teenagers that have moderate to heavy stain. It's by far the most efficient way to debride plaque and stain and even soft calculus. I currently use a cheap eBay air polisher, which works relatively well, but it's not. I mean, the quality is not quite there to use it. To use it every day on most patients. It just it does break down. You have to maintain it. One of the things, there's one particular seal on those things that goes pretty quick, and I think I figured out a way how to fix it and maintain it. And I'm going to probably share a video about that in the near future. But everyday use. I'm going to eventually get a name brand version, as I would like to use air polishing on most patients, and that's my plan. I think the main reason why most hygienists don't embrace air polishing is because of the mess. And for me, the way I reduce it is I use as I mentioned before, I use the Isolite mouthpiece, but I use it in combination with a wide HVE tip. But I can only do that because I have two HVE valves. So if you don't have two valves, you can always add one. It's relatively easy to do that. The fifth product is Ultradent's Ultra Seal XT Hydro Sealant. It's Ultradent's new sealant. It's the difference with this one. It's a wet bond technology, kind of like Embrace, which is one of the sealants that I used to use. I used to use Embrace and CleanPro, which are both very good sealants. But last year I decided to try the Ultradent's new sealant, and I just started seeing my 6-month recall patients a few months ago, and the retention has been fantastic. I would say it's a little bit better than CleanPro and the Embrace. For some reason, Embrace, with the directions, they ask you to leave a moist surface, which is kind of tough to do sometimes. With Ultradent, they just say dry the tooth normally, but you don't have to get like crazy with it. Make it super, super dry, which is nice. You just kind of dry it off, place the sealant, and you're off. So now it's my go-to sealant now. It's fantastic. The sixth product and the last is Headlight and Loops. I've been using Headlight and Loops for a couple of years. In hygiene school, they push loops, and like half the class got them. We got 2.5s, and I kind of got a little frustrated with it because they didn't really recommend getting a headlight. So it was kind of a pain in the ass with the overhead light, and I just got frustrated with it, and I stopped using it for like a year. And then about a year after hygiene school or so, I decided to buy a headlight and just to give it a try. And I combined it with my old 2.5 loops. And that's when you really saw the benefit of the loops. Like, it's a combination of the headlight and the loops that really makes it work. And then I eventually felt 2.5 wasn't enough, and I just jumped right to 4.5, which a lot of people say is too much for a hygienist, but I think it's perfect. It's like, for me personally at least. I highly recommend getting loops and a headlight because personally I can see so much with it. When you're looking for subgingival calculus, you blow the air, you blow back the gums and dry the tooth, and you can really see stuff deep into the pocket. And with sealants, when I clean the grooves out, you can really see how clean they really are. And when you're placing the sealant, you can really do it in a very detailed way. And I just can't live without it now. Personally, I use the Medlight, which are pretty cheap loops. They're about $4.50 a piece. And I use the Luminedent Headlight, which is very affordable light and very high quality. And they provide just super, super customer service there. So if you're not using loops and a light, I highly recommend getting them. I can't go back. All right, so those are the 6 products that I really can't live without in hygiene. If you guys have any questions or comments, you can comment on the blog. I have a lot of links on the blog post with all for all these products. So if you're watching this video or whatever, and you're not at the webpage, you can go to markrdh.com. And again, if you have questions, comments, you just comment on the blog, send me an email or whatever. All right, thank you.